Tell me something about TB drugs. Yes, sir. Anti-tubercular drugs. The main first-line drugs are four drugs: isoniazid, rifampicin, pyrazinamide, and ethambutol. Isoniazid, rifampicin, and ethambutol, all three are bactericidal drugs, whereas only ethambutol is bacteriostatic drug. And in cases of isoniazid, it causes side effect of hallucination, change in memory, and neuropathy. And to prevent this neuropathy, mostly pyridoxine intravenous injection is given. And rifampicin causes yellowish, reddish, orange discoloration of the secretions and makes the urine reddish orange. And it also causes contraceptive failure because it is a microsomal enzyme inducer, and hence it is causing side effects of uveitis, polymyalgia, iridocyclitis. Pyrazinamide is not active against slow growing intracellular mycobacterium. The most common side effect of pyrazinamide is hepatotoxicity and peripheral neuropathy. And ethambutol causes orange green color blindness, and it also causes optic neuritis. In cases of tuberculosis, the second line drugs are para-aminosalicylic acid, amikacin, capreomycin, antibiotics such as ofloxacin, ciprofloxacin, kennamycin, clarithromycin, and a newer drug called as bedaquiline or linezolid are all the second line drugs. Resistant TB is classified into two types, namely multi-drug resistant TB, in which there is resistance to rifampicin and isoniazid, and and XDR TB, in which there is resistance to rifampicin, isoniazid, fluoroquinolones, and at least one second line injectables. In cases of treatment for tuberculosis, there are two phases mainly: intensive phase and continuous phase. In intensive phase, HRZD is given for 2 months, and in continuous phase, HRE is given only for 4 months. Okay, tell me something about HIV drugs and retrovirus. Sure, sir. Retrovirus is nothing but HIV virus, human immunodeficiency virus, which is mainly caused due to which mainly causes AIDS, acquired immunodeficiency syndrome. The main risk factors are sharing needles from an infected person, blood to blood transfusion from an infected person, and perinatal transmission. Okay, the main anti-HIV drugs are of these classes. Entry inhibitors include CD4 inhibitors, CCR5 inhibitors, and GP120 inhibitors, and reverse transcriptase inhibitors, integrase inhibitors, and protease inhibitors. In cases of entry inhibitors, they are mainly effective against HIV-1 and HIV-2. In entry inhibitors, it includes fostemsavir, temsavir, maraviroc, vicreviroc, cenicriviroc. These all are second line drugs for resistant HIV. In reverse transcriptase inhibitors, it is mainly of two types: nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. Reverse transcriptase inhibitors, they are effective against both HIV and HIV-1 and HIV-2. They include lamivudine, emtricitabine, and tenofovir. These three are the first line drugs for treatment of HIV, and non-nucleoside reverse transcriptase inhibitors are effective only against HIV-1. Nevirapine, delavirdine, dorapirin, and among these, efavirenz is only the first drug of choice. For treatment of HIV, mostly we give 2 NRTI and 1 NNRTI. NRTI include zidovudin, tenofovir, lamivudin, emtricitabine, tenofovir, didinanosin, and abacavir. And integrase inhibitors. In integrase inhibitors, it includes daltegravir and dolutegravir. These are the second line drugs for treatment of HIV. And protease inhibitors include squaminavir and indinavir. In NACO guidelines, it includes for adults, in which we give 2 NRTI and 1 NNRTI. And for HIV with pregnancy, if the female is already on a regime, then we continue the same regime for her, and we continue the same regime. And in cases of post-exposure prophylaxis, we give tenofovir, lamivudin, and also lopinavir or ritonavir. Post-exposure prophylaxis is best if given within 2 hours, but it can be given for maximum of 72 hours also. Okay, tell me something about torsion of testis. Sure, sir. Torsion of testis is an emergency surgical condition in which the testis rotates around its own axis. It is mostly seen in people with risk factors of undescended testis, and in cases of high investment of the tunica vaginalis. The clinical features mainly include young adults, young males, in which there is acute abdominal pain along with vomitings. Even vigorous lifting of heavy weights also causes stretching of the cremasteric muscles. Since it is an emergency condition, we do a emergency exploration of the scrotum to see the testicles. If the testicles are viable, then orchidopexy, repair of the testicles, is done. And if the testicles are necrosed, then we do orchidectomy. Okay. Tell me something about peripheral vascular disease. Sure, sir. Peripheral vascular disease is a vascular condition affecting mainly the arteries and the large and medium-sized vessels, causing obstruction in them. It is mostly due to atherosclerosis, which is caused by fatty deposits called as plaques in the large arteries. The most common risk factors for peripheral vascular disease include elderly age group, diabetics, hypertensives, and in people who smoke, and in obese patients. It is mostly seen in males compared to females. And the patient mostly complains of claudication pain, that is pain when he walks for a little distance, and crampy type of pain he feels. The most common investigation which is done is Doppler, along with the routine investigations such as blood sugar levels and hemoglobin levels. And routine Doppler is done to see the arteries where the obstruction is, to locate the site of the obstruction. And in the treatment, it is mostly of preventive measures. Preventive measures include lifestyle changes such as avoiding smoking and taking control of hypertension, regular exercise, not eating fatty diet. And then if the plaque is very much increased in size, then we can do percutaneous intervention. Or if it can't be managed conservatively, then we can go for a surgical intervention. Okay, tell me something about anti-epileptic drugs. Sure, sir. Epilepsy is a condition in which there is increased secretion of the excitatory neurotransmitter. The excitatory neurotransmitter in the brain is glutamate, and Due to the increase of excitatory neurotransmitter, there is a decreased inhibitory neurotransmitter, which results in epilepsy. So, for the treatment of epilepsy, we generally give GABA analogs, GABA agonists, or glutamate antagonists. In GABA analogs, we give benzodiazepines or barbiturates. Benzodiazepines include diazepam, lorazepam, and clonazepam, and barbiturates include phenobarbital. In glutamate antagonists, there are two classes of drugs, namely AMPA inhibitors and NMDA inhibitors. In AMPA inhibitors, they are topiramate and lamotrigine. Topiramate and lamotrigine, they both are, topiramate is used for seizures and mainly and prophylaxis of migraine, also used in controlling alcohol and smoking habits. Lamotrigine is mostly the drug of choice for bipolar disorder, partial seizures, myoclonic and absent seizures, Lennox-Gastaut syndrome, and it is also the least teratogenic drug. NMDA inhibitors include valproate and magnesium sulfate. Magnesium sulfate is most commonly used the drug of choice for eclampsia in pregnancy, and valproate is used for myoclonic seizures, tonic and clonic seizures, absent seizures. And the other drugs which are used as anti-epileptics are phenytoin, carbamazepine, and ethosuximide. Okay. Tell me something about organophosphorus poisoning. Sure, sir. Organophosphorus is a compound which is mainly classified under the irreversible anticholinesterase esterase inhibitors type, in which the drug binds to the acetylcholinesterase enzyme irreversibly, thereby it increases the concentration of acetylcholine, because the enzyme has been blocked, as the enzyme acetylcholinesterase metabolizes the acetylcholine. So in this case, when the acetylcholinesterase is blocked, it increases the acetylcholine levels, which goes and binds to the nicotinic and muscarinic receptors. In cases of organophosphorus poisoning, mainly the muscarinic receptors such as bradycardia, gastritis, diarrhea, bronchospasm, increased lacrimation, salivation, and urination is seen. And in cases of nicotinic actions, only muscle twitching is seen. So, for the treatment of organophosphorus poisoning, we initially give atropine, which blocks the muscarinic actions, and we give atropine till the time we see the signs of atropinization. The signs of atropinization include heart rate greater than 100 beats per minute, dryness of the secretions, and dilatation of the pupil. The maximum dose of atropine which can be given is 200 milligrams per day. And the second line of treatment which we give for organophosphorus poisoning is to reactivate the acetylcholinesterase so that it can degrade the acetylcholine. Mostly the acetylcholinesterase reactivators which are given are known as oximes, such as pralidoxime and diacetyl monooxime, which goes and binds to the anionic site of the acetylcholinesterase enzyme, thereby reactivating the enzyme. Okay, tell me something about retrovirus. Retrovirus belongs to a group of virus which includes human papilloma virus 1 and 2, and these are mostly caused due to the sharing of the needles from an infected person, and from an infected mother to her baby, which is known as vertical transmission, and due to unprotected physical contact. And in this retrovirus, mostly the prophylaxis can be given as anti-HIV drugs, which include tenofovir, endinavir, squavimabir, abacavir, and in cases of exposure to a infected person for healthcare workers, we can give post-exposure prophylaxis, which can be given up to a maximum duration of 72 hours. Okay, tell me something about hypothyroidism. Sure, sir. Hypothyroidism is an endocrinological condition in which there is decrease of thyroid hormones, namely T3 and T4, and increased TSH levels, thyroxine stimulating hormone, in which the symptoms mainly include all the symptoms which are due to decreased T3 and T4, namely loss of hair, lethargy, intolerance to cold, and then the patient can have mixed edema, which is accumulation of fluid in the subcutaneous tissue, and mostly pitting type of edema is seen, and the patient can have dry and scaly skin also. So for the treatment, mostly we give thyroxine 50 mg or 75 mg on fasting. Early in the morning, the patient is advised to take on an empty stomach. Okay, tell me something about malaria. Sure, sir. Malaria is a most common most common disease, which is caused by the Plasmodium species. The Plasmodium species are various, which are Plasmodium falciparum, Plasmodium malariae, Plasmodium vivax, Plasmodium ovale. And malaria is one of the condition which is included under the National Vector-Borne Control Program for the elimination. And mostly the malaria is mostly the malaria which is due to Plasmodium falciparum is dangerous because it can cause meningitis, and it can cause to death of the patient also. And in mostly all the Plasmodium vivax, falciparum, and ovale and all, the treatment which we usually give is artesunate combination therapy, which includes artemether, artesunate, lumefantrine, and the other drugs which can be given are chloroquine and primaquine. And in cases of malaria in pregnancy, in first trimester we can give quinine, and in the second and third trimester we can give artesunate combination therapy. And for prevention of the malaria, we can use mosquito repellent ointments, and then we can keep our surroundings clean by seeing if any water clogged areas are there, and filling them with sand, and clearing all those water clogged areas near our houses, and covering the sewage areas, because stagnated water forms a rich breeding source for the malaria species mosquitoes. And we can use mosquito nets and mosquito electrical appliances, so that it can prevent the breeding of mosquitoes during rainy season. Okay, tell me something about myocardial infarction. Sure, sir. Myocardial infarction, also known as coronary artery disease, is mostly due to uh, is worsening of the angina. The most common symptom which is seen is chest pain, which is retrosternal in nature, and it sometimes radiates to the left arm or forearm, and it aggravates on exertion and is relieved by rest or intake of nitrates. MI is mostly, the precipitating factors include lack of physical activity, sedentary lifestyle, increased consumption of fatty acid substances, and it is mostly seen in male gender compared to female gender, sir. And then It is mostly seen in the elderly age group and in diabetics also. And in cases of myocardial infarction, it is mostly of two types. Initially, angina can be present. It is mild chest pain, and it has two types: ST elevation and ST depression type. In ST depression, we can do troponin assessment, which is the best cardiac marker. And if the troponin levels are normal, then it is classified as unstable angina. If it is elevated, then we label it as non-ST elevation MI. In non-ST elevation MI, it is mostly due to small thrombus. Mostly we don't do any surgical intervention because the thrombus autolyzes on itself. So we give conservative management only. In cases of conservative management, mostly we give initial first line drugs such as nitrate, which increases the coronary blood flow. Then dual antiplatelet drugs such as aspirin and clopidogrel are given. Then antithrombotics such as enoxaparin are given. In cases of ST elevation MI also, we can do troponin assessment, in which if the troponin levels are normal, then we term it as variant angina, which is due to vasospasm of the medium and large arteries and not due to atherosclerosis, in which we can give nitrates and calcium channel blockers. In troponin levels are elevated, then we term it as ST elevation MI, in which the initial management includes nitrate, then aspirin can be given, and clopidogrel is given, clopidogrel and aspirin, which are antiplatelet drugs. Then IV nitroglycerin is also given, and the definitive management includes percutaneous intervention. Okay, tell me about the abdominal incisions. What do you know about abdominal incisions? Yes, sir. Abdominal incisions mainly are the right subcostal incision, which is known as coccus incision, done for open cholecystectomy, and the McBurney's incision, which is given at the McBurney's point, which is mostly done for appendicectomy, sir, and a midline incision, which is done for most of the abdominal surgeries, and then subumbilical fan and steel, subumbilically given incision called as fan and steel incision, which is used for lower abdominal cesarean section. Okay. Tell me what is meant by lacerations. Lacerations are a type of wound, sir, in which the tissue is avulsed and it presents with irregular margins, and there is a breach in the tissue, sir, and with slopy edges. Mostly we can clean the tissue, and then we can wash the area with normal saline, so that any microbes or any foreign particle is there, foreign body, it can be removed, and after that we can suture the wound, and then we can put a dressing. Okay, tell me what all types of sutures are there. Sure, sir. Sutures mainly are divided on the basis of filaments as monofilament and polyfilament. Monofilament are only single thread type. They do not have any crevices, so there is no any risk of bacterial infections. Whereas polyfilament sutures, they are braided sutures, and they are very strong compared to mono sutures. And because they have crevices inside them, they form a nidus for the bacterial infections also, sir. And the mostly used monofilaments are ethylene and proline, monocryl, and chromic catgut also. They are unstable sutures. because the suture memory is very high, and in cases of polyfilament they are stable knots. Because the suture memory is low, hence they are used mostly by surgeons, which are vicryl, polydioxone, and silk. And depending upon the absorbability also, they are divided into absorbable and non-absorbable sutures. Absorbable are further divided into natural and synthetic type. In absorbable natural type, it includes catgut, which is derived from the sheep gut mucosa. It is not used nowadays because of increased inflammatory reactions. And chromic catgut is another variant of catgut, in which the catgut is coated with chromic salts. Even this is not used these days. And in synthetic type, it is of vicryl and polydioxone type, dexone and monocryl type. They are mostly used um, for ligating the vital structures. And in non-absorbable sutures also, it has two types, namely natural and synthetic type. Natural type includes silk, cotton, and synthetic type includes proline, nylon, polyester, and steel type. Mainly, there are four types of suturing techniques known as running and continuous sutures, simple sutures, simple interrupted sutures, mattress sutures, which further includes vertical mattress and horizontal mattress, and subcuticular sutures. Thank you.